cost of living crisis is something I'm really worried about. I think a lot of us are, and we haven't really started to see the effects in the NHS yet, but it's coming. You know, people who aren't eating in their homes, people who can't eat properly, all of these things are going to have a medical impact. And actually, there are some people who can benefit from social prescribing to support them before things get to a crisis point. You know, before their rent goes into arrears or their electricity bills in arrears, these sort of things. So I think that they're going to have a big role to play, and ultimately it's only by expanding that service and having more of that service that we can reduce the pressures in the NHS and allow clinicians to focus more on the medical side of managing their patients.
In Dudley, we're running a programme called Warm Welcomes, so we're looking at how these projects can be open at a set time every week so that people can come in, have a hot drink, but also just make new friends, make new connections and find out about other activities that they can get involved in as well. And the link workers are supporting the people they're working with to prepare for the winter as well. So they're thinking about how they can use what money they have wisely, so what things they might be able to purchase that could help set them up for the winter.
I think certainly with the cost of living crisis, the winter pressures coming in, we've certainly seen in COVID that these roles are priceless, certainly the social prescribers and health wellbeing coaching, in terms of really addressing some of those needs which happen as a result of life-changing events.
Part of our role is also to increase capacity within the community. So for example, the CCG they've given us an amount to increase capacity for financial advice. So we were able to second a financial advisor from South West London Law Centre.
We run a campaign every year called Warm and Well, where we've visited lots and lots and lots of community centres, faith groups, GP surgeries, local social workers and so on, and we kind of have a pack with information, and it actually has a fleece hat and a scarf and some tips. So that's quite a well-established campaign which is sort of backed by Merton, and we see very positive results from that. But we are definitely seeing lots and lots of requests for financial help around fuel bills. That's absolutely kind of shot up, but now we give financial support to people when they've got bills to pay, and we collaborate very closely with some other sort of environmental charities like home insulation and energy efficient light bulbs, but I think for a lot of people it needs to be more immediate than that. We're thinking about extending our opening hours because we have got a warm space here and people can come and just have a cup of tea, you know, and we can offer that.